And we have Andrew Yang, who is founder of Venture for America, a nonprofit focused on creating jobs in cities recovering from the Great Recession. This first question is about increasing COVID-19 vaccinations in communities of color. Community Service Society issued a report today that found that 36% of Latinx and 31% of Black New Yorkers said they or a family member had COVID-19 versus 21% of white people. And as of this week, New York City has vaccinated just 5% of the population. So candidates, what would you do to ramp up vaccine distribution in New York? And would you prioritize distribution in communities of color over other groups? If so, how would you do that? Mr. Yang.
So many New Yorkers are frustrated right now because we're in the midst of a crisis and we know the vaccine is our pathway out. But the vaccine supply has been insufficient. People are frustrated with, as Kathryn suggested, there are multiple websites and organizations to try and make an appointment. And then the prioritization is unclear. So number one is supply. We are the original epicenter of COVID-19. Pfizer is literally a New York company. And it reminds me of the PPE competition under Trump, where all of the localities were competing for resources and were bidding against each other. New York City needs to have an adequate supply of the vaccine. That's job one. And the mayor should have been working toward that goal continuously until we were sure that we had enough of the vaccine. Number two is our healthcare information system do not talk to each other, which is why Kathryn's right about how fragmented it is. We need to have one intake so that people can know where they can get their vaccine, what's the most convenient location for them. The best resource that exists in that direction right now, I think, is being run by ABC Eyewitness News, which is not what you need if you're going to restore confidence in our government. The third thing is that we should be vaccinating essential workers who are more disproportionately of color.
Thank you. Thank you. I want to ask you a follow-up about that because you have talked about a vaccination passport of sorts and using that. And I wanted to ask you about that and also ask you how that would, in using that and using technology, you would ensure that is equitably applied, given the fact that there is a digital divide between white and Black and brown and communities of color and low-income communities.
New York City is a place-based economy. We need to be able to convene in schools, in businesses, eventually in restaurants and bars. And so after you get vaccinated, there is something that universally happens. You get a card and it says your name, where and when you got vaccinated, whether it was the first dose, the second dose, everyone gets one of those cards. Now the goal is to try and add value to this card by, as Eric suggested, actually checking in with a database so that you can have that information confirmed. And if you do have a smartphone, you can just show, it shows green, says you've been vaccinated in a particular time frame, or during this interim period, perhaps that you've gotten a negative test in the last little while. Now, do you need a system where you can also just present that vaccination card and then have someone confirm it manually? Yes. That is lower impact because someone can't confirm it against the database, which the app can do, but everyone gets that card. And eventually we have to get to a point where to drop your child off at school, for example, you can flash that card, someone looks at it, knows you've been vaccinated, you can enter that school safely.
This next question is about immigrants' access to health insurance. Federal and state policies limit eligibility and discourage access to health programs available to citizens and lawful residents. That results in higher uninsured rates among immigrants. As mayor, what types of programs or policies would you champion to maximize enrollment of immigrants in quality insurance coverage that they can also afford? Mr. Yang.
Opportunity here in part because the emergency room is unfortunately serving as primary care for many of these folks that are uninsured. There have been very, very admirable efforts to try and get more folks coverage through NY Cares, through these neighborhood action centers. I would suggest that we need a neighborhood action center in Queens, one of the most diverse areas, and obviously has a very high level of immigrants. And that would be, to me, one of the first things we need to do. The goal should be to try to get folks coverage regardless of their documentation status. And one of the most powerful tools to do that is ID NYC. ID NYC is available to all New Yorkers. We have to try and tie basic access to both healthcare and financial services through ID NYC, and let folks know that even if they have this ID, it's only going to be used in ways that are going to give them access. We're not going to track them or do something that they would mistrust in some way. That has to be one of the primary goals of the next mayor, is to restore that trust.
This next question is about equity in healthcare for communities of color in outer boroughs. So COVID-19 pandemic is illuminating the devastating toll that unequal distribution of healthcare infrastructure has had on our city's communities of color, particularly in the outer boroughs. And in 2020, Manhattan had 6.4 hospital beds for every 1,000 residents, while Queens had only 1.5 hospital beds for every 1,000 residents. Similar disparities exist in the Bronx and in Brooklyn. Now, communities have heard a lot of lip service from policymakers about addressing healthcare system inequities. What would you do as mayor to ensure that the healthcare infrastructure, this is very important, we're talking about infrastructure, not just access. What would you do to ensure that it is distributed equitably? Mr. Yang.
We have such a vastly unequal healthcare system in the city, where you have some of the best world-class research institutions in the world, and then you have massive hospital bed shortages and lower life expectancies in areas of the Bronx and Brooklyn. You have to try and solve for the lowest hanging fruit opportunities. Again, I reference neighborhood action centers in places like Queens, where right now they're not getting the right kind of primary care or access to urgent services. And then I agree with Kathryn that we have to make better use of the capacity we do have. I would love to be able to build new hospitals in some of these healthcare deserts, but in the interim, we should be utilizing more of the capacity in some of these hospital networks where they do have much higher levels of resources, and let folks know, look, you might not have the beds in the Bronx, but we actually can cross the bridge and bring you to NYP and these other facilities.
Thank you. Thank you. I guess my question for you to follow up on that is, how would you work between the different hospital systems? Because that's been a problem, and even for instance, in terms of COVID response, it's very uneven in terms of which hospitals have resources and which ones don't. And I guess my question to you is, if you're trying to distribute that infrastructure and that capacity more evenly, how would you get, for instance, public and private hospitals to work together, or public or private hospital systems to work together on that?
No, the perfect example of this is what's going on right now with vaccination, where, again, you have people logging into public hospitals, urgent care centers, and the private hospital networks. And the private hospital networks don't share their data either. While we're in the midst of this crisis, we need to have a sense of the capacity in both public and private hospitals, and then have more leadership, frankly, in being able to connect citizens to resources right now for the vaccine, but also moving forward, if you have another crisis, to be able to see where you have capacity and where you have a need. This is the frustration that so many New Yorkers have, is that we have institutions and systems that are siloed and don't talk to each other. And one of the primary missions of the next mayor has to be to get folks around a table and say, look, like, we're still trying to get ourselves out of this crisis, and we cannot have you husbanding resources that are literally going to save lives if applied in a neighborhood like only a mile or two away. Like, this is a leadership exercise. It's an administrative barrier. It's not even really a technological barrier, because these systems have the capacity to actually share information if you actually just push them to do so.
If elected mayor, would you consider creating a commissioner level post with the charge of promoting and ensuring equity across government agencies and policies? President Biden has done something similar through a position on his domestic policy council, but would you do this in New York City commissioner level post? Mr. Yang.
I would, but I'd go a step further. I think we need to amend the city charter to include addressing the racial health gap as a central mission of all of our agencies, especially the DOH, MH. It's unconscionable, the disparities that we're seeing. The one that pains me the most is the mortality rate for expectant Black mothers is 8 times that of a white mother. So we need to make this the central mission of many of our agencies and actually have this as the key benchmark. It's just unacceptable that people are dying a decade earlier in Brownsville and Greenwich Village. It's unacceptable that Black mothers are going into the hospital on what should be a joyous day, only to be suffering tragedies at such a high rate. So to address these, we need to work at it every single day, particularly for the Black maternal mortality. I believe we should be expanding provision of doulas. I believe that women listen to women and will empower them to make sure that healthcare providers understand.
Thank you, Mr. Yang, but I will give you a chance later on to talk about that plan a little more, because we will have a question about that. This next question is concerning New York Health and Hospitals. New York City's public health and hospital system serves hundreds of thousands of low-income, uninsured patients annually. And policy experts and advocates have long argued that it is underfunded by state lawmakers that control the allocation of billions of dollars of indigent care pool and Medicaid. Just this past week, the governor's budget proposes to slash funding for New York City's public hospitals by another $139 million. Mayors typically have been unable to turn this situation around. What would you do to improve the financial stability of New York Health and Hospitals? And I do ask that, that you talk about the hospital system in your answer. Mr. Yang.
Ray is 100% correct that we need to get the resources from the state and the federal government. And the budget that you're describing envisions a multi-billion-dollar deficit at the state level, and Governor Cuomo is going to the feds and saying, look, we need $15 billion to fill this budgetary hole. And if we get that $15 billion of the roughly $350 billion that I think was envisioned in this last Recovery Act that President Biden has proposed, then I believe that the money that we were describing hopefully will not be taken out of the New York City Health and Hospitals budget. It's one reason why we should all be celebrating the fact that Chuck Schumer is the new majority leader, that we have a real chance for real aid and real relief out of the federal government, because the stark truth is that in this case, that's where the resources are most likely to come from. That's what Governor Cuomo is fighting for out of Albany, and the mayor needs to be Governor Cuomo's partner in saying that New York has been sending over $25 billion a year more to the federal government than it's been receiving for years. There is no national recovery without a New York recovery. That includes the state, that includes the city, and that includes the $139 million plus that we need for the New York City Health and Hospitals. And I agree that's not enough. We should be growing this and not contracting.
Thank you. Thank you. I do have a follow-up because it's very important for the mayor to work with the governor as well as the federal government. And can you talk a little bit about how your relationship with the governor and the federal government be more effective in doing this?
The interests of the city and the interests of the state are 100% aligned in terms of getting appropriate levels of federal aid. The fact is the city is the majority of the economy of the state. And the fact that the governor and the mayor have not been on the same page has been very, very negative for the folks who live right here in the city. We've all seen it. We've all felt it. I aim to be a friend and ally and sidekick, if necessary, to the governor to make this case to the feds. I'm friends with his brother from CNN. I'm very easy to get along with. I'm all about just trying to get stuff done for New York City, and I will give the governor all the credit in the world. I'll just be behind him clapping as we get the aid necessary for the city and state. Like Shaun, I also do have a lot of friends in DC. So I'm with Shaun on that score. He's got their numbers. I've got their numbers. We're gonna make sure that we get what we deserve.
Can I know the brother and the governor, so that's
Thank you.
Let's all call them. Like everyone here, let's all freaking.
Everybody got their number.
Let's all get on the phone and freaking badger the heck out of them.
Let's do a Zoom call, all of us.
We're going to move on to our next question. And this one is about protecting patients from medical bills that they can't afford. 60% of New York City residents say they faced a healthcare affordability burden in the prior year. And over 6,000 New York City residents have been sued by New York's nonprofit charitable hospitals for medical bills, often at a 9% commercial interest rate. Hospital lawyers usually win these cases on default, and most patients do not appear in court, and none have lawyers. And many hospitals, on the other hand, while they've paused this practice during the pandemic, our question is, what would you do as mayor to protect patients and prevent nonprofit hospitals from filing these lawsuits and other unfair and discriminatory hospital practices beyond the pandemic? I will first ask this of Mr. Yang.
This is such an important question. If you look around the country, healthcare costs are the number one source of bankruptcy, and it's worse here in New York because you have set of pricing that lacks transparency or rationality. You have procedures that are 40 or 50% more expensive, like 20 blocks north of another hospital performing the same procedure. And then you know who ends up paying for it? The public, in ways big and small. So I agree with Eric that we need to bring these hospitals to the table and not let the fact that they're nonprofits let them blanket themselves as completely immune from accountability, from price gouging, from suing indigent patients. Because the fact is, if you do lawyer up and fight these charges, they cut the charges very quickly. There's like no true cost to a lot of these procedures. Like they'll end up billing you, like $80,000 for something, and then if you lawyer up, like all of a sudden the $80,000 comes down to $20,000 very, very quickly. So we need to bring them to the table and also say, look, you have this tax exemption that is worth hundreds of millions of dollars a year. You're benefiting from fire and police and other services, and you are gouging the public in many, many ways. You need to actually publish your rates transparently so we can compare them across systems. That alone would be a game changer because their rates make no sense. They know it. And as soon as it's exposed to the light of day and the public realizes how much we're paying, we can change it. It's not the indigent that are getting screwed. It's the public.
This next question is about addressing the racial gap in maternal deaths, which was mentioned before. But I'll set the stage. Between 2011 and 2015, Black women accounted for 54% of pregnancy-related deaths, but only 20% of births. Meanwhile, white women accounted for 11% of pregnancy-related deaths, but 33% of births. Let me do that again because that was a little garbled. Black women, 54% of pregnancy-related deaths, but only 20% of births. Meanwhile, white women accounting for 11% of pregnancy-related deaths, but 33% of births. So what would you do as mayor to address the maternal mortality crisis experienced by Black and brown women in New York City? Mr. Yang, you mentioned this before, so please.
Kathryn's right about stress levels and the amount that you work while you're pregnant. To me, I'd like to reflect on, I met with this Black mother who almost bled out while giving birth, and she was very highly educated. I think the darkest thing about this statistic is that it's independent of the education level of the mother. And I want to trace back the way that we gave birth. I mean, not that I was around for this, but like women helped women give birth for eons, for generations. And then eventually it transitioned into our hospital system in part because there was money to be made. And the reality is that too many healthcare providers do not listen to Black women. They don't listen to women very often, and they don't listen to Black women in particular. So you need a doula who can help champion what that woman is going through. You need more Black healthcare providers who are more likely to actually heed the words of Black women. And that, to me, is the crucial opportunity to actually turn this around. It is a crisis. It's despicable. It's deplorable. It's the intersection of racism and misogyny in the clearest way. And it's a vital moral obligation for us to address it very powerfully.
With that, we are right on time to wrap, and everyone has 30 seconds for closing remarks. Mr. Yang.
Thank you for this opportunity. This has been a terrible time for so many New Yorkers. Over 26,000 lives lost, over 700,000 jobs that we've yet to recover. It's been a disastrous time for our mental health. We're going to need to do a number of things to get out of this crisis. I'm running for mayor because I believe I can accelerate our recovery, but also make us a more equitable and just city. And I want to amend the city charter to make addressing the racial health inequities key to the mission of every city agency. I believe that's one of the opportunities in front of us, and I'd love to work with you all to make that happen.
Put the money in our hands. 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 Can we afford it? Yes. Will it cause inflation? No. Is it awesome? Yes. Is anyone trying to make it happen? Yeah, that guy.